Hey guys, and welcome back. Today I want to talk to you about how I treat constipation. Constipation has to be one of the top 3, if not the most common clinical complaint I come across in clinic. If you or your loved one has constipation or having difficulties with bowel movements, then this video is going to be for you. There's going to be information here that you're not going to find anywhere else that is highly valuable, I guarantee it. I'm Dr. Glover. I'm a clinical gastroenterologist out in Las Vegas, Nevada, and GI is what I do all day, every day. It is important that we first define constipation because too often it's assumed to be simply inadequate frequency of bowel movements. And yes, that's part of the definition, but there's more. I would define constipation as poor satisfaction with bowel movements associated with decreased frequency and or difficulties having a bowel movement, meaning there's straining or incomplete evacuation. And I think the second part of this definition is often overlooked. Let me give you a few examples. I have some patients in clinic who have maybe one bowel movement per week, but it's well formed, meaning it's Bristol 4. There's no symptoms, there's no straining, they feel great. And in these cases, despite having only one bowel movement a week, I don't consider these patients to be clinically constipated. If we look at the other extreme, I have many individuals who have daily bowel movements, but the stool is poorly formed, meaning it's Bristol 1 or 2. There's a lot of straining, sometimes there's some bleeding. So despite having daily bowel movements, the patient is clinically constipated and we treat as such. So if we suspect constipation, what part of the workup needs to come next? The next part of the workup, and I know no one likes this, you need a colonoscopy. Think about it this way. The colon is basically a long tube, right? So if there's any kind of blockage, God forbid a tumor or a large polyp or maybe a stricture or narrowing, that needs to be identified and addressed. And the colonoscopy is really the only way to do that. If you haven't had your colonoscopy yet, maybe you have symptoms or maybe simply for colon cancer screening, check out this video I did about the 4 essential questions to ask before you get it done. So if you've had a normal colonoscopy, the next thing we need to consider is the possibility of pelvic floor dysfunction. I want you to think of your colon as actually 2 organs, one of which is your colon in and of itself, which reabsorbs water and forms the stool, but that's markedly different from the anal rectum. The anal rectum is actually very complex and it serves to facilitate a bowel movement. I think a lot of people don't realize this, but the actual act of having a bowel movement is not very straightforward. There's many muscles that have to relax and contract in a coordinated fashion to facilitate a bowel movement. And believe it or not, in many individuals, that mechanism is not working as intended. If your anal rectum is not working and there's things going on like pelvic floor dysfunction or dyssynergic defecation, the outlet is broken. You can be doing everything right in life, taking all the laxatives, but we're never going to have success if that's actually what's going on. To evaluate for a potential diagnosis of pelvic floor dysfunction or dyssynergic defecation, we use 2 tests in conjunction with one another, one of which is an anal rectal manometry to look at the function of the anal rectum, as well as a MRI defecography to look at the structure. Those 2 tests combined give us a very good idea of both the structure and the function of the anal rectum to make sure it's functioning appropriately. If you've had a normal colonoscopy and pelvic floor dysfunction has been ruled out, then we need to focus more on lifestyle, which quite frankly should always be done regardless. Our bowel movements are a reflection of 3 things, and that is the amount of exercise you get, the amount of water you drink, and the amount of fiber you eat. In terms of exercise, we're mostly talking about squat-like exercises. So I'm not saying you have to put 300 pounds and do barbell squats on your back, but you should be at least doing body weight squats on a daily basis or some fashion of yoga and Pilates. Too often now in the Western world, we're sedentary, right? You're either sleeping or sitting, when in reality, we're meant to be either standing, and when you're tired of standing, you're squatting, and vice versa. Because of the sedentary nature, the pelvic floor becomes very weak, and this is why it's important if constipation is an issue, to be doing some type of squatting exercise on a day-to-day basis. In addition to exercise, water is paramount. The vast majority of planet Earth is water, as are our bodies. So if you're not getting adequate hydration, then your stools are not going to be well formed. Shoot for at least 2 to 3 liters of water a day, and a good barometer to tell as to if you are adequately hydrated is what does your urine look like. It should be clear, and it's normal and expected to be going a couple times a day or even once or twice at night if you are consuming adequate water. Shoot for 2 to 3 liters of water a day. Water without fiber is not going to have much benefit in terms of constipation. A fiber nutritional deficiency is probably the most common nutritional deficiency in the Western world. I think the average American gets somewhere between 5 and 10 grams of fiber a day. It's woefully deficient. Keep in mind that not only does fiber help improve the quality of your stools, but it's also an essential prebiotic that your gut microbiome turns into probiotics, and this is essential for a healthy gastrointestinal system. By fiber, we essentially mean fruits and vegetables, so we're talking about things like oatmeal, blueberries, banana, kale, spinach, all the fruits and vegetables. There's very good evidence that the more variety in amount of vegetables you consume on a week-to-week basis, the better your bowel movements and the healthier your GI tract and microbiome. Not only does fiber help the quality of your bowel movements, but it's also associated with decreased chronic diseases, decreased hypertension, diabetes, stroke. Fiber is essential. So that's my brief overview of how I treat constipation in clinic. I hope you found some of this valuable and perhaps some points that you can incorporate in your day-to-day life. As usual, if you have any questions or comments, go ahead and ask below. I enjoy reading and responding, but otherwise, that's all I had for you, and I will see you in the next one.